They serve their country only to return home with depression, PTSD, cancer, and even vision and hearing issues. For many veterans, they might not know of the services available out there to help them. Today is the anniversary of D-Day, and this morning we are trying to do our part to help all veterans in need of medical services. The Morning Medical Update starts right now. And good morning to you. It is Monday, June 6th, and we are so happy and proud to be here live on location inside the National World War I Museum and Memorial here in Kansas City to discuss ways to help our veterans get the services and access to the services that they need to stay healthy in our communities. So thank you so much for joining us on Twitter, on YouTube, and on Facebook. So coming up today, we're going to talk a little bit about some of the major advancements and how things have changed in the medical community since World War I. And then in about 15 minutes, we're going to head back inside the studio to get an update on our COVID count from Dr. Hawkinson. And after coming home from the war, many soldiers face physical, mental, and social issues that make them a vulnerable population. Some of these issues include brain damage and depression. We're going to talk very deep about this today, so please make sure you get your questions sent in to us on YouTube, Facebook, and the Medical News Network. You can find links to those right there on your screen. Again, we are live here inside the National World War I Museum, and we are standing here inside this exhibit that really shows us how far medicine has come since World War I. And joining us to talk a little bit more about that and to kind of help walk us through some of these really interesting items is Dr. Matt Naylor. He is the president of the museum. How are you today?
Terrific.
Good to have you. Gosh, I have to tell you, I lived in Kansas City a very long time, and this is my first time inside this museum.
Well, welcome.
Well, thank you for the welcome, and it is just a beautiful, beautiful place, and I'm looking forward to you walking us through a little bit. So maybe just kind of start with a few things, and I have a few questions to ask you.
Sure. So, behind us, a representation of a field hospital. Their profound impact on the human body, and triage was one of those things which was, as it were, developed or invented at the time. The idea of how then do we identify those who we need to be, saving, and how do we do that? A field hospital is one of the places where that happened. Before then, they'd been moved to an evacuation hospital and then out to a base hospital.
So hundreds of beds set up.
Hundreds of beds, often within a mile of the front.
And tell us about this right here, this wagon behind us.
So moving those who are injured is always a tremendously difficult process when there's active fighting around. And so here we see one of those U.S. Medical units, which then would help transport the wounded.
So, Matt, you said there were three major medical advancements that came. You said triage was one of them. What were the
triage, and then the use of antiseptics. So the Dakin treatments, and then plastic surgery. So because of the way in which people were impacted by war, by the shrapnel and so on, plastic surgery was needed. The Tin Nose Society was one of those groups that outgrew, that came out of the war, where people then would seek to, as it were, cover their disfigured faces. So plastic surgery then was developed as a result of the war.
Something that we really just don't think about today, do
right.
we?
And that's right. And of course, the impact of artillery and such on the human body led then to the development of prostheses. And so here is an arm that was, we were called a couple of years ago by somebody who said, my dad was in the war and I've got his arm hanging in the hallway. Would you like it? And this was a family from Virginia.
And when you get those calls, what do you say? Yes?
Well, we're very interested in talking to folk. And as it was then, this is the arm that he wore for many years. When we then received and looked at it, we found that it had been constructed by the Kahn's Artificial Limb Company here in Kansas City.
Wow.
So we were sort of making its way back home here, and it helps to tell the story then of how people managed and coped with loss of limbs, of fingers, of legs, and so on.
And just really shows how advanced we've come. I want to walk down here just a little bit and see some of these tools, again, that we see all the time in our hospital, but tell us where they've come from and how they've evolved.
Sure. Well, what you'll see here is how the kits that were used in the hospitals, in the base hospitals particularly, are in many respects not all that dissimilar to the equipment which is used today. If we were to find ourselves in surgery Back in those days, of course, it was in some respects rudimentary, but so essential. And so here at the Museum and Memorial, we help to tell that story of the equipment which is used and the experience which was theirs. And of course, one aspect of the impact of the war, which we often we didn't understand at the time, is that which we talked about as being shell shock, which now, of course, we understand as PTSD, the impact of brain trauma and the artillery, which was so profound. So if you consider for a moment the Battle of the Somme, in the first 7 days, the British launched 1.5 million artillery shells, and that battle went on for 6 months, 20,000 casualties in the first day. So being in those trenches, being in that place with this incredible barrage of artillery, you can only imagine the impact that that has on the human body, but also on the human brain. At Memorial Day, the week leading to Memorial Day here at the National World War I Museum and Memorial, we placed 140 flags in the entrance area of the Museum and Memorial, each representing each flag representing the lives of those who have been taken because of the cost of war after service. The impact of service goes on for many years after. 140, as we know, around about 20 veterans or active duty personnel take their lives each day, 140 in any given week. And that was true during World War I as well, and after. Then we didn't really understand how to treat shell shock. The impact, though, on families, on communities, on economies, enormously impactful.
So we've come a long way when it comes to the medical advancements, but certainly the way we understand our veterans and how to care for them, right?
Right. And the need to be able to then provide extended services for our veterans.
I could stand and listen to you. I bet you've got some amazing stories, and I'm going to come back to you in just a little bit because you wanted to share some interesting information about the impact the pandemic of early 1900s had on Kansas City. So I want to come back and talk with you here in just a moment, okay? All right, thank you so much, Matt. Okay, so I want to talk about the issues that we have here at home and some statistics. 41%, roughly 1.7 million veterans across the country have mental health issues and needs. And so one of the organizations here in our area helping with that is the Battle Within. And I want to introduce you to two gentlemen who help run that organization. We have Justin Hoover. He is the executive director, and also Adam Majors. He is the clinical director. Gentlemen, thank you so much for being with us today. We appreciate it.
Thank you for having us.
So tell us a little bit about the Battle Within and how it got started here in our area.
Yeah, the Battle Within was really created by over 100 veterans, first responders, and community members with the desire to make sure all of our nation's warriors have the same opportunities to heal. We define a warrior as somebody that doesn't get to say no in the face of crisis. So that's your active duty, your veterans, your first responders, your dispatchers, your corrections officers, and frontline medical personnel. And really what we try and do is break down those barriers that exist that keep them from receiving the mental and behavioral supports they need. And so really what we've done is we've created a continuum of care using a community approach that's really been pioneered with this novel clinical approach that Adam Majors has created.
Adam, tell us a little bit more about what you do.
Yeah, so at the Battle Within, one of our goals is to make sure that we're setting the stage for healing. So apart from just the nature of the trauma itself, we also live in a culture and we work in a culture as warriors where we're usually not encouraged to speak about how we're really feeling and how we're really doing. So what we want to do is make sure that we're getting all the factors in place that are so critical to succeeding in individual psychotherapeutic treatment. We do that through our 5-day Revenant Journey program. The other thing that we do is make sure that we set those that we serve up with a therapist that is in a good spot to take care of them. And so psychotherapy is a highly individualized process. There's a lot of factors that can influence what makes a treatment more or less likely to succeed. And what we want to do is get each person with a therapist who we believe is in a good spot to treat them.
Are we getting better at helping our veterans? I mean, places like the Battle Within help. Are we getting there? How are we? And what else can we do better?
Yeah, we certainly are. And I think, one of the silver linings of COVID is actually reducing that stigma to mental health. I was actually at a fire academy a couple weeks ago, and there was a few veterans there, and just that question of asking, hey, who's had some mental health issues, and those veterans were willing to step forward in front of some peers and classmates and be vulnerable. And I think that's really what has come about, is that vulnerability is accepted, and that's one of the hard parts of war is just the intimate nature. Me and Adam were standing in the bomb crater here at the World War I Museum and sharing those stories of the different experiences we'd had in our own bomb craters. And, before that wouldn't have really happened because there's that stigma there that, well, whose is worse? I mean, he stood in a 2-story bomb crater. I haven't, and so how do you pull away? Because that isolation and that shame is really what leads to that symptomology, that PTSD, that depression, and ultimately suicide.
Well, and Adam, help us understand that. I mean, especially those who have not served. We so badly want to understand where folks are coming from and what those needs are. So, help us understand what the needs are and how we can help communicate better with them and help serve them just on a community level.
Yeah, I would say that, first off, having a traumatic reaction to something like war or trauma is normal. And so when somebody has experienced really severe trauma, we should expect that people are going to have a difficult time. And the best thing that we can do when we're speaking with somebody who's experienced something traumatic is just make it safe for them to share their experience and to be honest about how they're feeling and how they're doing, and make sure that we're giving them a chance to open up without having anybody shame them or try and talk them out of it. So just creating as much room as possible for them to have an experience that is authentic for them.
Matt mentioned earlier the suicide rates among veterans and those returning from service. How do we get those numbers down?
That's a wonderful question. I think it starts as we transition out. Transitioning is such a challenge for so many people. It's this loss of identity, and really you kind of scatter to the winds. It's easy to think that your problems are going to end with your service, and then come 6 months, 9 months later, you find out that they aren't. So really creating that sense of community and those advocates, and that's really what we try and do at the Battle Within, is really develop that sense of a community, and again, create where people feel like it's okay to be vulnerable. They come to understand that their story is the key that unlocks somebody else's prison. They become those advocates that help find those other warriors in the community and welcome them into this space. And so that's really what it takes. It takes understanding, it takes vulnerability, and it takes people really getting out there and supporting one another in community.
It sure does. So just tell us, what do you want folks who might be watching who might really need these services, or maybe has a family member or a friend or a colleague who needs these services? What do you want them to know?
Well, I'd say that there is help. We know for a fact that psychotherapy does work, and a lot of times if you've tried psychotherapy and you feel like it hasn't worked, there's a good chance that it might not have been a good fit, that maybe it wasn't the right kind of therapy, or that it didn't fit the person's situation. So I would just encourage folks to keep trying, encourage folks that you know or love who may be suffering to keep trying, and make sure that you reach out to organizations like us at the Battle Within, because we're very confident that we can help with most people and most of what they're going through. And there's a variety of other treatment options available. So when it comes down to it, just know that PTSD it's not a death sentence, that there are things that we know help, and we can help people to feel better and to find a new life.
It's something that can be managed and can be helped. Well, and thank you both for being with us throughout this pandemic. Both of you have been so great with your time to come on our show and help share your experiences and how we can relate them to what folks are going through now. So we appreciate that for sure. We put some information up on the screen as well, where you can find more information about the Battle Within. Gentlemen, thank you so much. I'm going to step over and talk to Matt really quick before we get to our COVID count back in studio with Dr. Hawkinson. So Matt, tell us again, we talked about the pandemic in early 1900s and the impact it had on Kansas City. Tell us more.
So, not only are we facing this massive global war, but then we get the flu of 1918, 1919. Here in Kansas City, it impacted profoundly. More than 2,000 people died here in Kansas City from the flu, and dealing with the same sorts of challenges as we do now. The arguments around the use of masks, should we have restrictions? How do we manage the economy? So there are political influences on medical directors' decisions being made, and so there's arguments around that. It's fascinating to read that history. And of course, then we didn't have a vaccine. So how would we get out of this? So, if for the United States, 116,500 those killed in World War I, half of whom were killed by the flu. So, the impact that it had on our servicemen was just enormous, and then on the citizenry, incredible. More than 600,000 people in the US died in a population 1/3 of the size of the current population of the United States, about 100 million people, more than 600,000 deaths. So, the impact in the United States was just enormous.
So some things change and some things stay the same,
they
right?
do. That's right.
Matt, thank you so much for your time this morning. We appreciate it, and thank you for letting us
welcome.
be here. Yes. Alexis, I'm going to send it back to you inside the studio. Get a COVID count with Dr. Hawkinson.
So fascinating to see all the displays. I just love the World War I Museum. It's just such a cool place. You could spend a whole day there. Dr. Hawkinson, what are the latest as our COVID numbers as we head into the summer?
Yeah, COVID numbers, active infections in the hospital are still pretty low. We have 9 active infections with 2 in the ICU, 0 on the ventilator, 6 in that recovery period. But I think what we've seen, Alexis, over the last few days certainly is that the infections seem to really be fairly stagnant, as well as the hospitalization. So hopefully we're hitting a plateau and coming down from this most current surge. Right now it looks pretty good for keeping people out of the hospital. I think we should continue to be optimistic about that.
We have a few headlines, and I'd love your reaction and your insight into these. The first one is really good news for parents. Parents have been clamoring for a vaccine, and children under 5 could get the vaccine as early as June 21st. So can you talk about what this decision is based on and what impact this could have on current cases?
Yeah, well, certainly it's based on the data analysis, and I know it has taken time for those youngest of our population to have that opportunity to get the vaccine. So it's really been based on safety and efficacy data analysis. So again, the FDA, everybody is doing their due diligence to make sure it's both safe and effective. And I think overall this is going to be great. This should also help keep kids in school, keep families safe, because if we are starting in late June, the kids will be able to get their vaccines, anytime after that. By the time we get into the new school year, hopefully that is one more thing that we can do to keep our kids in school and keep other families safe.
That'll put so many parents at ease. Also, there's a new study from the CDC. This is interesting. It finds that boosted Americans seem to be getting more COVID-19 infections. Why would that be?
Yeah. Again, I think what we're talking about here, the vaccines are supposed to keep us out of the hospital, keep us from severe disease. We know that particularly the new variants, the Omicron variants, and those sub-variants of Omicron really do evade the immune system quite well, most notably the antibodies. But we also know protection against infection, while it did occur early on after vaccination, we know that wanes. We know that decreases. Is that due to decreased antibody levels, which naturally decrease after vaccination or infection, or is it due to virus evading that immune part of our immune system? So I think it's a combination of both. And so I think, again, the word breakthrough or breakout cases or breakthrough or breakout infection, I think, is the wrong name or the wrong narrative that's been pushed. I think we have to understand that you can still get infected. Your chance of getting infection is certainly less after vaccination. That seems to decrease by about 4 weeks after the vaccine. But most importantly, I think we have to keep our eye on the prize. And what is that? That is the safety and the efficacy that those vaccines provide for keeping us out of the hospital and keeping us from severe disease.
Final question that I'd love to have you react to are the test to treat strategies. Now, we first heard about this in March. They've opened a clinic in Rhode Island. So test to treat is if you test positive, you can get immediate access to drugs like Paxlovid. So the question for you is, are we going to see something like that here in the Metro?
Hopefully. I think the White House announced more of a federally supported test to treat within the last week. I think that might be the Rhode Island one. I think they have a couple more sites that they're looking at. Again, these are federally supported and federally funded. We know that, just as you said, the test to treat was originally announced in March. I think that has had good effect by people going to those clinics or pharmacies getting tested and then being able to get Paxlovid at that point in time. So I think overall this is going to be good. This is one more strategy we can use to help keep people out of the hospital. We know if you're vaccinated and boosted, your chance of going to the hospital and dying is reduced by 90%. Another statistics that is thrown out, if you then get Paxlovid, especially if you are one of those high-risk people, you have another reduction of about 90% of going to the hospital in severe disease. So all of these strategies are good, again, to protect the most at risk of our population.
We have a lot of community questions that are starting to come in, also some great reporter questions. So we're going to get to those in a little bit, but we want to send it back out to Jess, who's live at the World War I Museum, as we all talk and learn together about multitude of issues that veterans are facing right now.
Alexis, thank you so much. Yeah, we are out here at the museum. We've got Gigi Sears over here to my far left. She is Assistant Director, Professional Engagement and Clinical Projects Coordinator at the health system. Big title. Had to make sure I got that all in. And we also have Dr. Nicole Yadlinski. She is a veteran herself and also a family physician at the health system as well. Dr. Yadlinski, I never miss an opportunity to tell you thank you for your service as always. So tell us from your viewpoint, what is one of, or more than one, of the major issues that veterans face right now in our time?
So one big issue is having access to care. So being able to find a physician who is aware of veteran issues and is aware of some of the unique challenges that our warfighters face as they transition to civilian life.
So you're saying that the services are there, but the trouble is making sure that they know where they are and how to get to them?
Correct. So only about 50% of our roughly 18 million veterans receive care through a veterans hospital, and the rest are obtain care through civilian networks, civilian physicians.
So what are the barriers? Why can't we make sure that they get that? Is there
I
we
think
could be
some
doing
of it,
more of?
Yeah, some of it has to do with location, and then some of it just has to do with awareness of the services that are out there for our veteran population.
And how long have you been in service?
I was active duty for 7 years, and then I spent another 8 years in the military medical system before transitioning to being a physician at the KU Health System.
So tell me what has changed, or maybe what has stayed the same as far as issues that affected veterans 15, 20 years ago to now.
Oh, sure. I think that there's a much bigger awareness of those mental health issues that veterans face, especially as they transition out of the service, and also that connectedness and the importance of community involvement.
So do you think that when a veteran comes back with an injury, just like a lot of injuries and illnesses that we can see, versus the things that we can't see, that must hinder people getting to help as well, I would imagine?
100%. When you're active duty, when you're in the service, your goal is the mission, and then as you come out of service, it's then you need to start recognizing and taking care of your own medical needs and paying attention to that care that you need.
And you have to put on such a strong front, and then it takes so much out of you, and then you're sent back home and left to seek out those services and get better.
Yeah, 100%.
So good insight. Thank you. I'll come back to you in just a bit. Gigi, how are you today?
I'm really good, Jessica.
Well, thank you always for the work that you do with veterans. And you started a program within the health system to make sure that veterans are loved and taken care of. Tell us about it and how they can access it.
So it's a veterans resource group, and it's available to all veterans that work at the health system. And it was very interesting to me that veteran status was kept kind of in an HR location, and there wasn't a great way for veterans to know who each one was and how to connect, so it seemed like the right thing to do to bring them together. So the resource group is kind of rooted in the idea of bringing together people with a shared background, shared passion, and I've never worked with a group that is in action and passion as this group, and so
tell me more about that. You said it just the camaraderie and being able to know who, like you said, on an HR level, when you hear that, it just sounds so very isolated.
Yeah.
We know who you are, but no one else knows who you are.
So that was the fun thing. One of the first things that we did, and Nicole, I'm going to point to you, was we created veteran badges so that the veterans could, one, identify each other, but it's also this great thing for connections with patients, and it's a bridge. It is an immediate bridge. So that was one of the first steps. Then we started working at on the electronic health record to add a field for veteran status so we could identify patients, which has led to a couple of other programs. We've been a conduit for getting used medical equipment into the community for veterans groups, and we've done a lot of volunteerism.
Such a passion of yours. Where does this passion come from?
I come from a military family. My son is, all of them combat vets. My son-in-law, my father, my uncles. One of my uncles was a POW in World War II, so kind of honoring them.
What is it like to have a service like this? We hope for them to be in all organizations, all hospitals, and all companies, but so people understand how important an organization and a program like this is.
We just want our military service members and our veterans to feel like the KU healthcare system is welcoming, that we understand the unique needs of that patient population, and that we're here to serve them.
So are you telling me that there is a disconnect when people don't know who you are, and that you said you want them to understand you better. Tell us a little bit more about that, so maybe we can understand you better.
Well, I really just want to encourage all physicians, clinicians out there to ask the question, have you served? What was that service like? How has that impacted you? Can I ask you more questions about what you did in the military and any possible repercussions that you may be experiencing now? Because then that opens that dialogue, and it allows for that communication to provide that care that that service member needs.
Well, I think, like you said, I keep going back to that word isolation, because you're right. I bet it is a good feeling when you connect with a patient or a colleague who says, when did you serve, or what did you do, or thank you for your service. It's just that connection that you have with people that, again, helps maybe stave off some of those mental health issues. Gigi, how has this program helped? What are you seeing actually on the other end of this, as far as how it's helping people and some of those results?
Oh my goodness, there's been so many things. One, we've worked on homes, repairing homes for veterans in the community. That's an amazing gift to give to people that have served and not able to do something for themselves at this point in their life. That providing some really needed medical equipment to veterans organizations. You know, one was we have access to a lot of things that are going to be not used. And there's one veterans group in the community that was using a massage table to take care of patients, to see patients. So just that small act of getting them an exam table so they have, and then things they need to put together an exam room to treat appropriately.
It's something that you just would not have seen decades ago, maybe a couple decades ago even, correct? Mm-hmm. And what's in store for this program? What's next? What would you like to see? Where do you hope that passion drives you?
So a couple of things. One big one is, since we put veteran status in the electronic health record, we know when they're in the hospital, and we also know when they pass. And so we're creating honor walks. So when a veteran does pass in our place, we will have veterans and others come line the hallway as that individual's body is taken on to funeral home for services. So that's one. Yeah, pretty
Have you
amazing.
done one of those? That's beautiful.
We do it for honor walks for organ donors now, so it mirrors that process, but the difference being draping a flag over the patient's body, and I think veterans would salute as it should be, as that patient passes by, and the rest of us can just, really be respectful and show our gratitude.
Because I think that's what we all want to do, especially on a day like today. It's really, I always say, when you come down and I get to talk with you, it's every day is a day we honor our veterans, but when we stop on a day like D-Day, just to take a moment, and we definitely say thank you to both of you for all the work you're doing, and again, thank you for your service. Dr. Yadlinski, good to see you. Do want to check and see if we have any reporter questions on the line today. Okay, I'm going to send it back to you, Alexis, to see if we have any great community questions.
We have some fantastic community questions, Jess, and I just got some reporter questions from Natalie with the Kansas City Star that she sent via email. So I'll get to those right now. These are for Dr. Hawkinson. Yeah. Natalie would like to know, how long does a booster shot last, and when should you get a new booster shot?
I mean, this is a pretty big question. Again, so really what we've seen is a fairly good effect, a reduction in infection after that vaccine dose, whether it's your second dose, whether it's your third or your fourth. That will help reduce infection, but not by a great amount. That percentage of reduction in infection goes down, but really what we have seen is that you still have very good effect for protection against going to the hospital, even 6 or more months out. This is 85% or more. So again, of course, during that, you're thinking about comorbidities such as age, heart disease, lung disease, kidney disease. But really what we have seen is if you've had that primary series and you had the booster, you are really well protected. There is data out of Israel also showing that if you've had that fourth dose, especially if you're in that high risk group above 60 or above 65, that fourth dose continues to add better protection. So overall, the answer is you are still very well protected more than 6 months out from that last vaccine dose or that first booster for most people. So I think people should take comfort in that. Will we have to get new or redone or reboosted on a yearly basis? Again, we are still waiting for the full recommendations from the CDC and the Committee on Immunization Practices. I think most people are expecting at least a once a year shot, once a year boost. But again, we are also looking at different formulations of the vaccine too, so hopefully that will help as well.
Her next question hit close to home because I'm getting over my COVID that I got last month. Some current COVID-19 patients have avoided the virus for more than 2 years, only to catch it now. What percentage of current COVID patients have COVID for the first time? And why do you think this is? They've made it this far. We dodged a bullet for 2 years, and now
I don't know. I don't know the exact numbers, unfortunately. I don't know if it's been published anywhere. We can certainly try to look for that number. But we do know that we do hear that anecdotally that people who have not had it, I'm one of those people. I believe, my family is, my kids, and I have younger kids who are all around kids. My son had to be quarantined 4 times at least early on in the pandemic because of people around him who had it. So I don't know the exact number of who is getting it for the first time, but we know and have heard that. We have friends here who I work with, colleagues, the same thing. They've got it for the first time as well. Some people are able to escape it even though they've been out doing those high-risk things such as going to concerts, bars, restaurants, parties. I don't think we know exactly why. It is certainly luck, but the answer to the question, I don't think we know the number or the percentage of people who have now just gotten the infection for the first time.
And then the final question from the Kansas City Star before I go to community questions, and I have some, Jess, for you out in the field as well, for your experts out there. Should patients report positive home tests to the city, county, or state, and if so, how?
Yeah, I think that's a good question. I think we were trying to look at that. We know there have been talks of, are you able to submit a positive test result to the local health department? I'm not sure of the actual methods to do that at this point in time. I don't know what systems are in place to be able to do that. Certainly you could call the local health department. That would be the first place to go through, is your local or county health department, and see if they are taking those numbers. Again, good question, and we've talked about this. Why is it so difficult? I don't think we know the extent of the true infections just because of that fact. Either people are not testing or they're testing at home and keeping that result because there is no necessarily system to report that.
Question out in the field for Jess, for the experts that you're with. I know they don't have their earpieces, so you'll have to translate for us. Isaac would like to know.
They do, actually.
Oh, they do. Fantastic. All right. Yeah. So our viewer Isaac would like to know, were there lots of negative reactions to the fireworks at last week's celebration at the station because of PTSD from loud bangs?
Yeah. So, I'll tell you my own personal story is my spouse was also an Army veteran, and fireworks are always a big trigger for him.
What else could you tell us about that? And what do you hear from other veterans?
Yeah, everyone's story is so unique, but yeah, a lot of times the fireworks really bring back a lot of memories and traumas for people that's a challenge for them, for sure.
How does your husband manage that?
He usually goes into a nice quiet place and surrounds himself with our dogs and puts on his noise canceling headphones and just sort of chills out.
I would imagine that's the case for many.
Yeah, 4th of July is not a big celebration for us anymore.
I generally get a lot of calls from those that I serve with, and we end up, talking about some more stories after they've gone through. So it seems like a lot of people reach out if that's something that they're struggling with during that time.
Yeah. Interesting. Very interesting. Alexis?
Joe Ellen has a question for Dr. Hawkinson about boosters.
Yeah.
Big questions about boosters this morning. When could we expect the CDC to give a guidance for a third booster, especially for people over the age of 65?
Yeah, again, I think these are probably coming down within the next few months, probably before the fall. Again, for a second booster, that is recommended right now for those that are over 50 who have gotten that first booster. So really, if we're talking about a third booster, I think you also need to include in there about immunosuppressed patients. But I think those types of recommendations are probably going to be coming down in time for the fall. Right now, certainly they are working mostly on the young or the pediatric vaccines. We know that is a big part of their June meetings, the committees. So I think there will be more information about repeated boosters or either every 6 months or yearly boosters or vaccination, probably coming down this fall. Again, I think that will also have to do possibly with the vaccine formulations. We know they are working on things like bivalent vaccines in which you have 2 different types of spike, maybe one Omicron, maybe one original spike in one vaccine. So all of those things are coming down. They are analyzing the data. I don't think we'll know anything really until the early fall.
Interesting question from Victor Macias.
Yeah.
Victor would like to know, he says he's read medical news articles that COVID affects testosterone levels. Is this true, and is this being addressed?
You know, I think we have seen COVID, SARS-CoV-2, affects all parts of the body, and so we know these things are being addressed. We know it's been found in all parts of the body as well, the virus has. And so there are these investigations going on. To what level, it's hard to say. We know that any critical illness, especially if you've had severe COVID, can affect all parts and all organs of the body. So these are questions that are being evaluated for sure. Some more than others, just because they are more prevalent than others, and you really need to get funding is big, being able to have the time and the resources to do these investigations, but these are some of the questions that are being looked at for sure.
Ruth would like to know if you feel that testing at home is helpful and or reliable.
So that's very good.
It's a good question,
you know.
from Ruth.
And again, I would also like to thank Isaac. He always asks those insightful questions too as well. So testing at home, there was a recent publication that was looking at testing at home, and what it showed was that really serial testing at home with the antigen test in those first couple days is probably better if you get negative results. They showed that the sensitivity, the ability to pick up an infection really peaked at about 77% by day 4. So people were testing negative. And as they went on for those first couple days after symptoms started, they saw that they were still testing negative, but by about day 4, they were testing positive, but only at a percentage of 77%. So I think if you have a negative test, it is probably better to go ahead, especially if you have symptoms and or have been exposed to people, to probably test 2 or 3 days in a row. The other thing that you can do is really try to get in for a PCR test that has a good turnaround, say within 24 hours. Why is that important? Because if you get a positive test, especially if you are high risk, it's important to try and get that Paxlovid, because that is really going to be most beneficial within 5 days of symptom onset.
And that's a great point, because I took 3 at-home tests. They all came back negative. Had I waited, Dr. Hawkinson, had I waited 4 days, I would have, I don't know what would have happened to me, because on day 2, I was qualified for the monoclonal antibody infusion because I'm at risk. So I wouldn't have hated to see what would happen waiting 4 days. Jean has a question. Doesn't more infection, hospitalization, etc., mean more reproduction and more variants, which could lead to a variant which evades current vaccination and treatment? So is masking the best way to prevent that altogether?
Yeah, again, are there best ways? We know that there's a multitude of factors in trying to prevent infection and further replication. I think that's exactly right. Anytime you have people that are infected, you can have replication. You can have new variants that arise, especially in those people that are immunosuppressed. They don't have an immune system to fight off and clear that virus. And we have seen this in different populations. You know, we know South Africa has been home to identified new variants, and why is that? Is there a more immunosuppressed population down there with their uncontrolled HIV/AIDS? That can certainly be due to it, but again, it's a multitude of factors, and it especially is in those immune-suppressed populations where we know you can have continued viral replication for weeks or months. So that is a very good question. You know, all of these things are going to help reduce the chance of spread, whether it's vaccination, early treatment, masking, all of those non-pharmaceutical interventions, trying to do things outdoors, trying to reduce the spread as much as possible. So would certainly agree that those things do help to help reduce the spread, help reduce infection overall. But again, are people going to be doing those? We know that when decisions are made at the community level about mandates and restrictions, there are things other than medical information and medical data to go into making those decisions. But certainly, again, we've always said too, if you are going into a situation and you don't feel comfortable doing it, you can stay out of it, but you are always welcome to wear a mask. We know mask wearing for that individual also helps reduce infection as well.
Polly has a question about Paxlovid. Polly would like to know, if you get the Paxlovid, is it still a 90% chance of avoiding hospitalization if you're not vaccinated?
Yeah, so that is one of the things, is a lot of that clinical trial was looked at in unvaccinated populations. So you still have an excellent chance. And we know, we've heard about the rebound in the clinical trials. We knew it was about a 2% of people in the clinical trials that took the medicine and then later on had a rebound in symptoms. But even what we are seeing and the latest information out is those people still are not getting severely ill, still are not having to go to the hospital.
We have more community questions that are coming in. People are, I guess, it took a weekend to marinate on this.
And I would like to say too, that is why in the NIH treatment guidelines for outpatient, Paxlovid is the #1 recommended therapy, with again monoclonal antibodies being more of an alternative. So,
Michelle would like some clarification. She says, I've heard mixed messages from doctors and pharmacists about that second booster. I'm 41. Had my first booster in November. I have heard I am eligible, but then I've also heard I'm not eligible. Yet I've heard some places are giving second boosters to anyone 4 months post first booster, as long as they're over 18. So try to unscramble that. Seems like Michelle's getting a lot of conflicting information.
You know, and I think that has happened all over the place. Again, the recommendation from the CDC is that those who are 50 and older, certainly if you are otherwise at risk, and the terms of at risk are quite broad, and so if you have any other comorbid conditions, you would possibly qualify for getting that second booster. But really the recommendation is if you were over 50 and you've had your first booster, you would be eligible for a second, unless you are immune compromised. And again, the definition of immune compromised is quite broad if you look at those CDC definitions. It encompasses a lot. And so if you are working with your medical teams, if you have some other comorbid conditions, you would possibly qualify as immunosuppressed or immune compromised and be able to get that second dose. But if you are just otherwise 41 years old, you've had your boost, there is not a recommendation to get a second one at this point in time.
Booster question from Victor. Victor wants to know why the booster shot made him feel so rotten. He says he felt like he had coronavirus after he got the booster shot. So he wants to know why.
Well, I mean, I think we've seen this throughout the vaccine, the COVID vaccine era, since the vaccines were rolled out. Some people get significant adverse events or side effects, and some people don't get any. Some people do fine with their first two, and then some people get side effects, or some people do really bad with their first two and have nothing. And so I think it's just heterogeneous. There's just a variety. It's just different for everybody, even during the boosting. So there's no really rhyme or reason. No. And again, getting those symptoms or not getting those symptoms does not have an effect or does not tell you about your immunity. You are still getting an immune response. You will still be protected from the virus.
Hoping, because I got super sick from all of mine.
Right.
So I was hoping it meant I was super protected. Then I still got COVID.
Yeah.
And my husband had no reaction, and he has not gotten COVID.
Yeah, and I think I had some reactions with the first two and nothing with the third. So I think, it is just different from person to person and different from dose to dose.
Well, these are some great questions, great community questions. I want to toss it back to Jess Lovell, who is out at the National World War I Museum for some final thoughts on a fascinating topic of veterans and the health care for veterans.
It really is an honor to be out here today and talk with all of these folks. DG, I'm going to start with you. Just some final thoughts of what you want our folks and our entire community to know.
I think connection is the antidote for a lot of things, and providing emotional support, especially for a group of individuals whose work family was their friend group, also people they often lived with, and have left that. And this is, makes them very vulnerable and looking for that opportunity to have connection and recognition and support.
Thank you for being with us today. Dr. Yadlinski.
Yeah, I just want our service members and veterans to know that there's help out there, and then for all of our physicians and clinicians to ask the question about military service and to know that there's lots of resources that are available to help them care for that population.
The battle within, that is one of those resources. So Justin, just final thoughts from you, and I hope we can put some information up about the battle within and where folks can find you, but what do you want us to know?
Yeah, I think what a great backdrop here at the World War I Museum to say that this is something that's been going on for a long time and has affected so many. and it's a battle within each of us, but that doesn't mean you have to fight that battle alone. And so all those resources and thebattlewithin.org is a great place to go and learn about how you can start, not just with our services, but also the KC Warrior Coalition of other nonprofits that support our nation's veterans. So don't fight that battle by yourself.
Thank you. It's always great to have people who've been there and walk the walk every day, and we walk away with so much insight and learning so much. So thank you all. Really appreciate it. Alexis, I'll send it back to you for final thoughts.
And I want to send it over to Dr. Hawkinson. What's on your mind this morning?
You know, just great messages here. I think we need to continue to give thanks and respect to those who have served and those who continue to serve, and obviously continue to support them after their service. I think that's a great thing to do. We know the Veterans Administration and their hospitals do a very good job of that. So just continue to give support to our veterans and those people that serve to help protect our country.
And gosh, if you get the chance to go out to the World War I Museum, if you're watching at home and wondering what to do today, it is just a fantastic museum. It's such a treasure here in Kansas City. We want to thank all of you for joining us for the Morning Medical Update. Remember, you can catch our shows anytime. Just log on to Facebook, YouTube, or Twitter. And as we leave you, we would love to share with you our gratitude and share a little bit about our families behind the scenes at the Morning Medical Update by celebrating our service members, ones who have served and ones who are serving right now.
Monkeypox, COVID-19, bird flu, 3 viruses dominating the headlines. I'm Jessica Lovell. The new information to help protect you and your family. We'll break it all down Wednesday at 8 on Open Mics.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.